Hi guys, Ariana here at the AAFE Training Center. Here I am with my beautiful patient who just kind of came to me and was experiencing a good amount of pain in her trapezius muscles. So after doing a full assessment and kind of figuring out where her pain was located and if it was mild, moderate, or severe, I marked her up and we had gone with 3 trigger points per trapezius muscle. So as you can see, I'm really working on isolating that muscle. I definitely want to be isolating it the whole time that I'm in there with a needle, just out of safety. So I always, kind of have my patients shrug up. I do a really good grip on the trapezius muscle, and then I start my triggering. So I go in with my needle, I aspirate whenever I go in, and I give a little bit of lidocaine just for comfort. So in my syringe, I have 2% lidocaine and botulinum toxin kind of mixed together. We dosed her appropriately just based off of her pain, the amount of stress and tension she had and how big and bulky that muscle was and what she was trying to achieve. So here I am just kind of working my way around. You can see that needle is almost bending because she was so tense. And whenever I find my patients when I'm struggling, I know my fingers always end up getting really sore. So all I say to students and just to myself is to take a break, pull the needle out, relax your hands, give your hands a little bit of, like a massage and just let them rest for a second because it's very easy for your fingers to kind of cramp up. So you can kind of see we had to stop the video. I needed a break and we kind of just continued. I want to make sure that we're doing it the right way. So if that means you need to take a break 20 times, then that's totally fine. But here I am just working on another trigger point and kind of doing the same thing and working my way around. It's totally normal for some trigger points to be worse than others. I normally start my assessment with my patients just asking them exactly where that exact pain is. And they normally know and have a spot on their back and trapezius that they just point to. And once I kind of assess it and they wince, I'm like, okay, this is the first trigger point that we're going to go after, and I'm going to target this one pretty well. So with her, that was actually the first trigger point that I did, and I'm kind of working more medially on this next one. But ironically enough, this patient came to me wanting filler in her neck, which is obviously not what we started off with treatment-wise. We did a full assessment on her, and a lot of her pain was TMJ related, and her neck was a lot of muscle movement. So we ended up doing trigger point therapy, trapezius botulinum toxin, and platysma band botulinum toxin. So we did a lot of things but filler in the neck, and that is going to be for another day. But I always like to start my patients with the full assessment, even if they say that they're coming in for something else. Patients don't always know, they know where their pain is and they know what their issues are, but not every patient out there knows what's best for them or all the options that aesthetics has to offer. So with that being said, I will see this patient back in 2 weeks, and I will likely do almost, if not exactly the same, assessment that I did this same day, just to see how she's doing and see how her pain is. Now here I am going back, same needle, but different syringe. If you can see closely, it's actually a 1 cc syringe because I'm going in here with just botulinum toxin. So I'm going in and giving her an appropriate dose for the size of the muscle and the pain she was having. She also wanted a slimming effect. So I was hoping to add in the trigger point therapy along with that slimming effect. Just because the dose and treatment is a little bit different and I wanted her to have the absolute best results. I always kind of end my treatments with a little bit of a massage. It really helps because I've been poking and prodding the patient to just give them kind of a more relaxing experience after the fact. It's always everybody's favorite part, and I kind of want them to have a positive kind of image of the treatment rather than that hurt so bad the whole time. I want them to feel comfortable, kind of relax them a little bit before I send them on their way. So here I am just doing the botulinum toxin on the other side, and I will keep you guys updated after I see this patient for her follow-up.